I would not even use the word moving. I think that we are growing in this understanding of it. And I like to use the word maturing. Is our mindset maturing about what quality care is versus what value is? And I think we all understand cost, but we don't understand value. The costs go up, but what about the value? And what does that mean? Costs go up? Is it for the year, for the episode, for the day? But we're getting smarter. And you look back over the years, and good gracious, Don, you follow this a lot. We've got so much better about our understanding of where we are today, but we've got so much further to go just because our thinking is so different. You're aware that last year we inventoried the reform models out there in cancer. We counted 35 of them, and they're all, although you say reform model or APM, they're all different. They've got their own differences in the care, their own differences in measurement, and their own differences in payment methodology. And I think part of the reason is that nobody's got the answer. We're trying to figure out what gets us there and what makes sense. And we'll talk about, what could happen to make it better for everybody. But it's tough because we're in a space that we've never before been in healthcare. Good gracious, one of few countries that even has the opportunity to put quality and value around healthcare. Everybody else is take what you get. I don't think it's given to them. So we're now stewards to say, okay, we want it to be better, but what does that look like? And let's come to an agreement on what quality is from the patient's perspective, from the payer's perspective, whoever the payer may be, and from the provider team itself. And all being united on what that quality is, what that value is, and working together to do that. And so if you slip up, then, hey, you're improving. And even if, let's say, you can have quality in, say, a product, but we're in the service industry, you can have quality in the service, but then you can say, suppose that service didn't happen as it should have. How is the quality when you're addressing that inadequacy or that outlier? So there's many aspects of quality, particularly in the service world. We just need to figure out what that is, and then also at the value. And good gracious, don't get me started about, okay, those people that are helping the process. We also need to get the suppliers of the drugs or life-saving drugs and the sciences and the tools to think the same way. They need the same criteria, the same focus on value that we're putting on providers and patients. We can't go along without their help. They can't go without our help. We all need to be working together on quality and value.